Welcome everyone to Track 1, the Leadership Track. This session will focus on effective leadership at the local and regional level. My name is Alyssa Ebo, and I'm delighted to moderate this session with my colleague, Mrs. Linda Echelanu. We are incredibly fortunate to have an all-star lineup of speakers this morning. That is, of course, morning if you're on the East Coast. We will hear from Dr. Alex Jahangir, Dr. Kolale Eskandanian, and Dr. Sunil Budhrani. Effective leadership is always an important topic, but in these uncertain times, effective leadership is critical, not only on the national level, but also on the local and regional level as well. Our speakers this morning will highlight some key aspects of leadership, as well as lessons learned in their respective domains. On behalf of the GW School of Business, thank you for being here. Thank you for your time. We truly appreciate it. Some quick housekeeping. For today's format, each speaker will have 10 minutes to present. If anyone has any questions, please note them in the chat box or the Q&A at any point. Following the presentations, hopefully we will have enough time for a Q&A session. Thanks in advance to Dr. who will co-question the Q&A. Without further ado, let's get started. Here we go. I'm honored to introduce to you our first speaker, Dr. Alex Jahangir. He is currently the chair of the Metropolitan Nashville COVID-19 Task Force. In addition, he's a practicing orthopedic surgeon and the director of orthopedic trauma at Vanderbilt University Medical Center. Dr. Jahangir is a professor of orthopedic surgery and the chair of the Metropolitan Nashville Board of Health. We are delighted to have you with us today to share with us your Nashville experience.
Thank you so much. I'm very grateful for this opportunity. Fun fact, I'm a GW alumni for undergrad, so the opportunity to speak at this meeting actually means a great deal to me. So I wanted to just briefly share about the Nashville experience. And maybe the next slide, if you don't mind, whoever's flipping through those. I don't think I can do that. Thank you. What I hope to get in my short talk is to kind of hit some of these key points here and just give you from an orthopedic standpoint, a person who's an orthopedic surgeon who happens to be placed in a large city role, kind of what I've learned in this experience and what I think could be good takeaway lessons for leaders, especially in healthcare and beyond. So next slide, please. So on March 8th, 2020, Nashville was, first case of COVID-19 came to Nashville. And this picture you see here is kind of what was my very first press conference. This is Sunday. The mayor calls on Saturday night saying, hey, we have this first case. And as you're the chair of the Board of Health, we want you to come speak. The gentleman immediately to my right was our new director of health, who was supposed to start the next day. So part of the challenges of leadership have been what happens during transitions of leadership when crisis happens. And so this is the very first press conference, and I tell you that because in a few minutes, I'm doing press conference about 71. So we've come a long way, and there's been a lot of lessons learned. Next, please. My message was essentially, Nashville, keep calm, and we don't really know what the heck we're doing. And I think that's probably the message anywhere in the United States, and if we're being honest with ourselves, and maybe still in some places in the United States, because I think this is a new challenge. And I think as leaders, part of whether you're leading at a division level, as I do in orthopedics, or a medical center level or a city level, this is probably the reality around most crises. Next, please. Really quickly about Nashville. Next slide, please. Thanks. Nashville is a city of about 700,000 people. And the MSA for our city is 1.9 million. And I think most people realize that Nashville is a music city. That's kind of what we branded ourselves really well about. But really, Nashville's other really strong industry is healthcare. As you can see, there are 5 healthcare systems and 2 medical schools in Nashville. And together, we have over 2,000 hospital beds in Nashville proper, and about 3,500 beds in our region. So for an MSA of 1.9 to have 35 million, to have 3,500 beds is a reasonable sized medical center. As well, as I mentioned, there are 2 large medical schools in Meharry Medical College and Vanderbilt University that really do a lot of research and so forth. So one of the first steps when after that press conference, which was on a Sunday, is that Wednesday, we realized, we as a city realized that, we really need to get our health system engaged. Just like, as I suspect at a lot of cities, the health systems and medical schools do have a certain level of competition amongst each other. And while there's some level of camaraderie, they are inevitably competitors. And I want to highlight TriStar Health is a division of HCA. And so HCA's corporate headquarters is here in Nashville. And did we lose our slides? Okay, perfect. So what I did was that very first day, I was, as the chair of the Board of Health, at that point there was no COVID task force, was asked to bring together the health systems. And we brought them all together in a health system CEO. And really quickly, we had to get some understanding and agreements that we're going to work together. And for me to be able to lead in that scenario, what I realized very quickly is there had to be a trusted broker. And while I am obviously very affiliated with Vanderbilt University, I very quickly had to make everyone realize that I'm representing the city here. And those are some interesting conversations that I think any leader needs to have early on with both whoever's employing them. So in my case, I spoke with the CEO and Dean of Vanderbilt pretty extensively about this, as well as with the CEOs of each of the large health systems, to make them recognize I am representing the city and the best interests of each system. And it was very important for me with early dialogue with each leader to say, if you ever see me favoring Vanderbilt, for instance, or not favoring Vanderbilt, maybe more so than others, is please be honest with me. So I think part of leading a time crisis is having the ability to build those relationships based on trust that would have to happen quickly. I did also lean on relationships I've had with other systems to give myself some credibility to the senior executives at each center, because again, trust was so critical at this point when nobody knew what was going on and there was worry about thousands of patients flooding our systems, stopping elective surgeries and so forth. Obviously, though, very quickly we realized that the partners that need to be brought in are more just the medical centers. And as you can see, some of the players here is our Convention and Visitors Bureau, the fire department, the local city government. And with these people, what I realized very quickly is that the culture around the way we approach healthcare leadership, I think there's a lot of deliberation. I think we as healthcare leaders try to bring a lot of consensus building for the most part to a lot of the things that we do. And there's a level of tolerance for medicine and leaders in healthcare, tolerance for maybe some risk in healthcare, but also there's a little less tolerance in uncertainty and making hard decisions when you don't have all the information. That is something that more, happens more in business and in government perhaps. And I think bringing those challenges together as a healthcare leader in the municipality role has been something that has been really interesting to learn. But we were able to do that, and early on, the mayor and actually the chief of fire pulled me aside after one of our meetings with the health system saying, you guys in healthcare are doing things totally weird. I don't understand what's going on. And I think a lot of that is because healthcare leaders are really good at trying to build consensus, and sometimes in moments of crises, that is not what we need. Next slide, please. So I want to tell you a little bit about, a little bit further. It's not just Nashville as an entity. Just yesterday, this report came out. It's making big news. We'll address it here in a little bit. The White House states that 11 cities, of which Nashville is one, must take aggressive action against coronavirus. So we started our first case in March 8th. We now have over 18,000. If you notice the star, that's Nashville. And Nashville has all these counties that come and go. And one of the biggest challenges we had early on is, as Nashville, we were the first in probably the Southeast to instill a safer at home order. We're one of the first to do a mask order. We're one of the first to continue aggressive tactics to stop the spread of this disease. But what we realized very quickly, as those, unfortunately, these have become politicized issues, Nashville is a very blue city in a very red state. So our surrounding counties, most of those, and our governor, most of them said, you know what, good luck. And what we were seeing is we were not having success in reaching what we needed to do to flatten the curve because of this regional response. And so what we've been able to do now is really, as a leader, finding what drives the regional areas. And what drives the regional areas is healthcare systems. Is we as healthcare leaders and healthcare systems are usually the biggest employers in these small rural communities, right? And we have leveraged, because of the relationship that we established early on, and that Wednesday after that first COVID case with our senior healthcare CEOs, they've leveraged some of those relationships in their rural communities and the community hospitals to tell the county mayor, hey, your biggest employer here is going to require a mask. Your biggest employer here is going to thinks this is what we need to do. And that has really led to pressure being placed to allow us now, almost everywhere you see in red around Nashville has now instilled a mask order. Everywhere for a while did the safer at home. So these are ways that I've been able to help influence our county, our surrounding counties. Next, please. Now, I want to talk just a little bit about what we've done and why cooperation amongst health systems, again, the foundation I just talked about, why that cooperation has led to results. Early on, within a few weeks, we set up these community assessment centers that provided free tests to all Nashvillians. Obviously, as a city or as an orthopedic surgeon by myself, I wasn't the smartest person in the room to figure out how to do this. So leaning on the experience of our health systems, which set up smaller testing centers, we quickly were able to leverage the city to set up the sites, the state to provide the tests, and each health system provided both expertise and staff for the first 6 weeks to staff these sites. We now have, as we've become more seasoned, have now taken some of the funding we have available to a city and actually have contracted Meharry to run all our centers. We have 3 centers. This last week alone, we did 10,000 free tests in our city. And this week, thus far, we've done 4,500. And these were all done because initially hospital systems literally gave their staff to us and their expertise and their process engineers and their MBAs to help set this up. Additionally, the alternative care site is our Overflow hospital. Thank goodness we haven't had to use it yet, but hospital capacity in Nashville is getting more tight. And so right before this call, I spoke with the CEO of one of the largest systems around, and we're working to, as a unit of a city, to say, hey, state, if we do these things, we need more staff and we'll be able to cover this many things. These are things that have historically never been done. Every system previously as a unit had been lobbying for certain things. We now, as a city and with our strength, are able to do this. The policy making, the safer at home orders and the mask mandates really came out of research, and advocacy by these health systems. If you see to the bottom right, that gentleman is a nurse who works in our COVID unit. He came on our mayor press conference and had probably the most views of anyone, saying, this is what COVID does to your body. This is why you need to wear a mask. I can go up there all day and say it, and I do, but I only have so much impact. So really leveraging our hospitals and the frontline workers to deliver the message we have found to be effective. Using our hospitals, when our safer home order came out, the CEOs of each system came out publicly and said, we support this because our hospitals can be overrun. And that resonates with people, and that public relations and messaging is critical. And then that's kind of some of the stuff we've done. Now, I've kind of run through a bunch of this, but I just wanted to share with you, the next slide, please, is really, we have, for the most part, kept calm and only have been able to have the success we've had because of our regional experience and our partnerships with the health system. So thank you so much for your attention. I'm very grateful for this opportunity.
Thank you so much, Dr. Jahangir. It was quite inspiring to hear your experience in Nashville. And I don't know if you'll be able to stick around for the Q&A because I know you're off to a press conference, but if not, really, on behalf of everyone, thank you so much for taking the time to participate this morning. We really appreciate it.
Very grateful. Unfortunately, I do have to head to that press conference. So thank you all so much.
No worries. Good luck. Thank you so much.
Bye-bye.
Bye-bye. It's now my pleasure to introduce our next speaker. Dr. Kolali Eskandanian serves as a Vice President and Chief Innovation Officer at Children's National Hospital. In addition, she is the Executive Director for the Sheikh Zayed Institute for Pediatric Surgical Innovation. Dr. Eskandanian is also the Executive Director of the FDA-funded National Capital Consortium for Pediatric Device Innovation, focused on accelerating the path to market with Dr. Eskandanian, mobilize and lead in response to COVID. I'm thrilled that she's here today to share her experience with us. Dr. Eskandanian, please take it away.
Thank you so much, Alyssa. So I'm going to share my screen. It says, who can share only host? Okay. Maybe you can, if you don't mind, you can advance.
No, I think we just opened it up for you. So try again one more time. I saw that and I jumped in.
No worries.
Does it work now?
Trying. Yes, it's
great.
Like it's working.
Perfect.
Great, awesome. So, yeah, is this better?
Oh, this is great.
Okay, perfect, awesome. Thank you so much, Alyssa, and thank you so much to ICSB Global for and the George Washington University School of Business for organizing this event. I'm honored to be here to speak with you. So Alyssa asked me to talk about leadership in the time of COVID-19. And I wanted to share with you the experience at Children's National Hospital in Washington, D.C. So to tell you a little bit about the hospital, we are in Washington, D.C., and Children's National is actually the pediatric department for the George Washington University. So we oversee all the residents at GW and also have lots of research and innovation collaboration with GW, including the Clinical and Translational Science Award that's funded by NIH NCATS. It's a very prestigious grant that Children's National and GW collaborate on. So the hospital is, Children's Hospital in DC is in the top 10 best hospitals in the United States, consistently ranked 4th year in a row. We're also #1 in neonatal care, so #1 in NICU, also 3rd year in a row with this honor designation. And we have 313 certified beds. So this is an acute care hospital specialized on the campus that you're seeing here in this picture on Michigan Avenue, but we also have regional outpatient centers in Maryland and Virginia and other areas of Washington, D.C. I wanted to put this topic of leadership in the time of COVID in the context of the strategic plan that we implemented a couple of years ago. And it has 3 pillars. And I'm bringing this up to demonstrate that why we were so agile and ready to address the pandemic that we found ourselves in early this year. So when we created this strategic plan a couple of years ago, we really focused on the 3 pillars that you see here. So clinical excellence, research and innovation, and community health. So from the foundation of the plan and which is the foundation of the plan and really informs what we are about and what aspires us to be excellent in what we do. So the early reports that came, you know, from China and other areas in the world were that children are largely spared from this virus and they're not that affected. But at Children's National, we decided to really monitor the situation and make our own assessment and be ready. We had daily calls with our colleagues internationally, our hospitalists and critical care colleagues around the world. So on a daily calls, our chief medical officer attended all of those calls and really shared experiences about what pediatricians in other areas of the world are experiencing and what they're seeing. And we know that, you know, there were some red flags raised. You know, it started really in the UK and then in the New York suggesting that the multi-system inflammatory syndrome in children, MIS-C, it is something very peculiar that is manifesting in children. And the association was with the virus. So some of the kids that presented with this syndrome were either tested positive for COVID-19 or they were around someone with COVID-19. We did publish very early in peer-reviewed journals to also add to the global knowledge. So we added to that global knowledge to let the world know that children are also affected. And this is really, an issue in pediatrics that it may have become a cliche to say that children are not small adults, but it's really important to understand that we cannot treat children the same way that we treat adults. So this was our contribution to the general knowledge that was available at the time. And what we also did to be helpful regionally to our adult colleagues, adult hospital colleagues, we received a certificate to be able to treat patients up to 20 years of age. So as a pediatric hospital, we were authorized to do that. We also dedicated an entire unit to care for patients, for pediatric patients that were affected by COVID. So other hospitals, if these kids were admitted to other hospitals, they could send them to us. So some level of readiness there. And also Children's National was the first in the nation to launch a drive-up testing site that was focused solely on children. And this was really implemented so fast early in the pandemic, and we implemented this site in 6 days. And it was made possible by philanthropy. Now, to bring you back to my first point that, I want to really link this leadership discussion and our agility and our responsiveness to the pandemic situation. I want to link that directly to the fact that we are a global leader in research and innovation. So we were kind of wired to respond very quickly and be ready. Before I go there, I wanted to let you know that a couple of innovative initiatives that resulted from the work that we did early on were to stay connected with our colleagues in other medical centers and engineering schools to see how we could address the unmet need of shortages. Shortage was a key term that presented itself in everything that we were talking about. So it was shortage of PPEs, and then, shortage of tests. And once we had the tests, we didn't have nasal swabs. So all these became, some problems that technology could help. So our Institute for Pediatric Surgical Innovation, in collaboration with University of Maryland, came up with a couple of solutions around additive manufacturing and 3D printing to address some of the very immediate needs that our healthcare workers needed at that time. And that was to print masks. And right now we're actually working on emergency use authorization for a mask ventilator in N95. a lot of, kind of real world solutions that were looking for engineering or technical, real world problems that were looking for technical or engineering solutions came to research and innovation looking for an answer. So briefly about, the notion of innovation at Children's National, it's all about bringing to the patients and to the market the best ideas to care for children. And this shows the roadmap for innovation. And the 4 elements that are included in our vision for innovation include, the traditional tech transfer program, our entrepreneur in residence program, and partnerships are very important to us because we understand that we may employ a lot of smart folks, but not all smart folks work for us. So we fill the gap with respect to expertise and knowledge externally where possible through partnership. And gap funding is another element that we have in place. I wanted to quickly talk about telemedicine, and I know that many hospital systems and academic medical centers were also very agile to ramp up their telemedicine initiative, and at Children's National we were not new to this concept. So we use telemedicine primarily for provider-to-provider consultations in the past and at an international level. So we had sites in Morocco, Ghana, that we had well-established telemedicine program with, but really overnight, we had to ramp up the operation to also transform our capabilities from provider to provider and provider to patients. And I'm showing in this slide some of the technologies that came out of the National Capital Consortium for Pediatric Device Innovation that presented to be very helpful for our telemedicine department. So I'm showing here a CAM patch for remote cardiac monitoring. Caretaker Medical is for remote vital sign monitoring. And ECHO, this is a well-established company, but did come through the National Capital Consortium for Pediatric Device Innovation for some advice to receive pediatric labeling for their FDA cleared product. So we leveraged, we kind of went to our Rolodex, if you will, and found who among our partners could help us or work with us to quickly introduce these novel technologies in our practice. I'm showing here because, there is a small business element to this conference today, showing the number of employee-initiated startups that came out of Children's National. And a good number of them are independently raising capital. So they're out there and working under regulatory clearance and or have a product that they're already selling in the market. I talked about, how partnership is important to us. And so in the past 7-8 years, we have formed a very impressive, I would say, network of experts around the world, mainly in the United States, but not only. So we tap into these experts on subjects related to regulations, reimbursement, clinical trial designs, as they relate to FDA related products, as well as manufacturing and commercialization. The National Capital Consortium, I mentioned already, had a key role in helping us identify some of the technologies that could immediately be used in the pandemic and specifically in our telemedicine program. And finally, I wanted to bring your attention to our new research and innovation campus that is on the former Walter Reed Army Medical Center property. So we received this parcel from the Department of Army about 5 years ago and are opening the first in its kind pediatric innovation campus in partnership with Johnson & Johnson J Labs that will have presence on campus. Virginia Tech is our academic partner on campus, and also Asper BARDA has an innovation zone on this campus. This is very important to partner with BARDA so we can early on, now that we have some lessons learned from this pandemic, you know, how can we use all the lessons that we learned and apply it to a future pandemic center, pediatric pandemic center. So if we find ourselves in this situation again, we are ready and we are even more agile than we are today. With that, thank you so much, and I look forward to the questions and answers section of this panel.
Thank you so much.
I'm going to stop sharing. Yes.
Okay. Thanks so much, Dr. for sharing your insights. We are truly grateful for your time as well. And now I will.
Thank you, Alyssa. So I will introduce our last speaker, Dr. Sunil Budhrani. He is the Chief Executive Officer and Chief Medical Officer of Innovation Health, which is a partnership and joint venture between Aetna, a CVS company, and Inova Health System. Dr. Budhrani is also an alum of GW, having completed his medical degree and his Master of Public Health here. He is currently a Clinical Associate Professor of Emergency Medicine at GW. Dr. Budhrani guides the continued success and expansion of Innovation Health with a focus on member growth and access to quality health coverage. Dr. Budhrani.
Great, thank you for the introduction. If one thing you can go ahead, I think you control the video starting for me. If you can just allow that, that would be great.
Okay, perfect. It should be working right now.
Perfect. Thank you so much. Well, welcome everybody. It's a real honor and pleasure to be a part of this session and join some of the expert colleagues you've heard, you just heard previously. I mean, you're gonna get an incredible amount of insight in a very unorthodox world we live in healthcare these days. Today, I'm gonna talk a little bit about my role, as you heard. I am lucky enough, I say I have 4 jobs these days. My primary job is I am the CEO and Chief Medical Officer of Innovation Health. Innovation Health is one of the first large-scale joint ventures between a major insurer, CVS Aetna, and Inova Health System in the Washington, D.C. metropolitan area, where we provide insurance coverage services for the D.C. metro area, both in the commercial and Medicare space. So that's my primary role and has been my primary role for 4 or 5 years now. But like many of you, I've added on some additional jobs. So as mentioned, I am a faculty member at George Washington University School of Medicine, my alma mater. I was lucky enough to have my milestone 25th reunion a year or 2 ago. So I was able to collect and get back together with my colleagues, and these are some of the unimaginable things, like celebrating occasions and milestones like this today that we are living in. So I work in the ER about once every week or so, and I get a chance to see front line, kind of what's going on. And, you know, I can't do more than just applaud GW's Department of Emergency Medicine, because they've done a fantastic job just learning from other countries, other cities, and really being a leader both nationally and globally when it comes to that Department of Emergency Medicine in guiding how we should navigate these waters. So great insight there. My third kind of role has been spending a lot of time in the DC metro area, spending time with our business partners, our educational partners through boards that I partake in and task force that I sit on, but also frankly in the media, whether it's news, radio, or print, really providing some insight on terminologies that have been thrown out to the public very rapidly. That could be in the form of whether and how we should be wearing masks, and what do the phase 1, 2, and 3 mean? How should schools and businesses think about reopening? So really putting those things together that I do in my professional life have been really helpful in a way that I have never been able, frankly, to do before, and educate the community on some of the confusion that's out there. And the fourth job is, I'm sure, one that you all can really all relate with, is just being a good dad, husband, family member to my own immediate family, but also my aging parents. So it's a fascinating time on that personal and professional life, and we're all working very hard, but I always say we have to remind ourselves, this is indeed a marathon, it's not a sprint. Things are not going to be fixed tomorrow or the next day. And even when we have a vaccine, I caution people to think it's going to miraculously go away. We have to think about, there's a process. Anytime a new intervention or a new therapy comes out, that we have to be thoughtful about building in time for people to adopt to that new therapy or that new intervention that's being done. I've had the honor over the years. I've been practicing emergency medicine all over the East Coast. I've directed and ran ERs. I spent some time before I joined Innovation Health in the space of telehealth. You know, it's an inflection point right now in telemedicine. A lot of barriers related to telemedicine have been reduced or eliminated. I got into the industry in 2012, 13. I chaired the national guidelines for the ATA on the primary care and urgent care telemedicine, because I was concerned that if ever we were going to get into a mode of people doing video and telephone, that we've got to bring the clinical kind of subject matter expertise to the table before everybody started running to video. And lo and behold, it took a pandemic for people to really start adopting and really moving towards it. So really interesting times to leverage some of the experiences I have and kind of forge forward in what we do. On the next slide, as I said, I'm going to talk about keys to effective leadership during a pandemic. I'll probably synthesize some of the things you have already heard, and you will hear later on in this great conference that's been put together. But I want to start off with some statistics that I think that are, you know, you're inundated every day with numbers and thoughts and feelings, but I think it's very relevant to talk about just an opening statistic. As of yesterday, there were about 15,117,078 cases, 620,033 deaths worldwide. And the infection rate, the mean infection rate, is looking like it was about 2.5. Just some key things in the United States. Highest number of COVID-19 cases, not too surprisingly, New York. Number of deaths from COVID in the US since the last couple of days, about 140,630. And the state that's conducted the highest number of COVID-19 tests, California, since July 15th. European country with the highest number of COVID-19 cases since July 20th, Russia. The European country with the highest number of deaths, the United Kingdom. And the total number of COVID-19 cases in Italy, because that's where we learned a lot of information, was about 244,624. Why do I say these numbers? And do I expect you to memorize them? Absolutely not. And I don't mean to paint a grim outlook. It's not too uncommon. We turn on the news and we leave depressed or saddened by what we hear. So the bad news in this presentation is we are in a pandemic, illustrated by the numbers that I mentioned. But there is good news. Believe it or not, there is good news. We do understand, even before the pandemic started, another little piece of bad news before I get to the good news, is we knew our healthcare system in the United States, and I'll focus on that just for now because globally different systems exist in different countries. But we knew in the system in the United States had some opportunity for improvement. You will hear people say we have one of the best healthcare systems in the country. You will hear that, there's no doubt. And I always say, if we have a patient who has a rare form of cancer or has advanced diabetes or stroke or heart disease, we are one of the best. We are really good at managing those kinds of very high acuity, sometimes rare conditions. What we have opportunity to improve on is coordination of care, social determinants of health, and preventive care and public health. I always say, if we take our diabetes diagnosis simply, okay, we know that people, when they can collect data on pre-diabetes, that's people with high blood sugars and irregular cholesterols and so on, and we couple that with the diagnosis of diabetes, the full continuum of pre-diabetes, diabetes has a scary statistic that'll show about 40% of Americans could end up in that bucket. That has an incredible cost and toll on this country. But we're not so good at preventing diabetes. We're not so good at preventing hypertension. And we're not so good at preventing behavioral health conditions. Some of these common ailments we're struggling with. The pandemic has definitely shown our flaws in addressing public and preventive health. It's not, you can just find that out by turning on or reading a piece of literature. So the good news in all this is, what I believe were the inherent kind of gaps in care we had in the US healthcare system are going to be addressed at a pace that's rather unprecedented because of the pandemic. We will move faster at trying to address public health and preventive care needs as a result of this, because it's completely stressed our system and it's had tremendous economic impact, which again, you all have heard and seen firsthand in the work that you all do. So in thinking about key essentials and trying to address leading and navigating in this regional world we are right now in the pandemic, and frankly, the things I'm going to talk about deal with on a global or national level. Now, one thing I will point out, never before that I can think of as practicing as an ER physician, and I was living in New York during 9/11, and I can tell you that was an unprecedented chaos in its own way. But the situation we're in with a global pandemic has put stresses on our system like we've never seen before. So one of the key things that's become more and more important is understanding in this country and globally the effect of coronavirus has had some very significant regional impacts and ways we need to deal with it. So knowing your subject, understanding the pathophysiology, the epidemiology, the prevalence, the incidence in your own regions is going to be key to understanding how we address the pandemic that we're in. Understanding our business. I will tell you, even before the pandemic started, I always joke, I have the great opportunity of working for CVS, a retail pharmacy provider, a retail store, front door of access to healthcare, Aetna, a major insurance company that's provided healthcare services for more than 150 years, and Inova health system, a major health system in the DC area, providing healthcare services throughout the region. I have the fun opportunity of working for all three of those organizations at the same time in the midst of a pandemic, which gives me a lot of assets and it gives me a lot of tools in my box to work with to understand what to do. I certainly don't know everything. My leadership doesn't know everything. So my job as as a leader of the organization is take the assets around me, CVS, Aetna, Inova in this case, but take the people around me and really get an understanding of what my business needs to have to thrive. What are the forces that are against it? And what are the forces that are pushing it forward? And understand how I put all that together, know my subject, and move forward going through this, the storms that we're headed. On the next slide, cultivate a strong team. We do this anyway in all of our business operations, in healthcare or non-healthcare, it doesn't matter. I'm a big believer in complimenting myself, not like the word that you're thinking, saying I'm great or good or so on. When I say complimenting myself, what I mean is complimenting my skill set. I know what I'm good at and I know what I'm not. It's really important to have some self-identification and self-understanding of what you can and cannot do. I have tried and prided myself, and we can all learn and improve from this, is keep myself surrounded especially with people that know information that I don't necessarily know. The pandemic has taught me that was one of the most important things that I learned from my mentors that I can do is surround myself by people that really have expertise in an area that I don't have. So if there was no pandemic, I was going to be on a successful trajectory. Now more than ever, being in the situation we are with coronavirus, being in the DC area, I feel very confident that I have a very strong team that we all complement each other. I know stuff that they don't, they know stuff that I don't, and together we can brainstorm and navigate how to pivot our business plan. Most large organizations have to create a business plan 1 or 2 years in advance with projections and goals and objectives and present them to some kind of board. We do that just like any other organization. But like many organizations, we had to pivot. And the only way you could pivot and be successful at pivoting is making sure you cultivated a strong team. I want to say one more thing about this. COVID has created an environment where people are affected differently by the impact of this virus. And what I mean by that is, and that's very kind of open-ended, it's affected me, you, everyone differently from a physical point of view. I have to remind myself, I'm working at about 130, 140%, as probably many of you are day to day compared to last year's calendar, okay? So it's reminded me that we need to sometimes make sure that we are get good at delegating, using our team to be able to do all the things that we do. But it also, COVID has taught us that while we all have responded both mentally and physically differently to this virus, there's also some very clear racial disparities in how this virus has affected communities. So having a diverse team of your makeup, not just in thought, but in backgrounds, ethnicities, and so on, has been helpful to understand how you coordinate a strong team to address the problem these days. So, you know, we've been blessed in terms of looking at it from those kinds of angles and providing different perspectives. On the next slide. Set a course of action. As I said, every organization should and does create a priority business plan that you present to your leadership, usually a year or more before, to plan out your 1 year, your 3 year, your 5 year strategy, and you constantly update it. Never in my recent history in running an organization have we had such a big wrench thrown into our last year's projections and plans and so on. But that doesn't mean you can't be successful running a business today. You just have to be intuitive and creative and agreeable. Some businesses are more challenged than others. Nobody can dispute that. But it is a time where we all need to think about, no matter what industry we're in, whether it's restaurant, retail, healthcare, what have you, about how we can creatively reform our businesses that need to address the short term, but very possibly could be still existing in the long term after the pandemic. That's where that new term always comes in, new norm. I mean, I can tell you how many conversations we have, and we hear that several times a day. So setting a course of action is very key, even in the midst of unpredictability. Because if you go in with the mindset that I don't need to set a course of action because it's going to keep changing and I'm not going to go there, and we do hear that, I think that's a mistake. I think still setting a course of action, trying to stick to it, but being thoughtful, which I'll get to it in a second, and adaptable are really going to be key to being successful. So a framework is what I'm getting at in setting this course. But as you will see in my subsequent slides, being malleable, being nimble are going to be key to be successful. Gathering expertise and being prepared to strategically and thoughtfully pivot. That's what I was alluding to in my last part of the conversation. So it's important to be able to make sure you understand, here's my foundation to be successful. In a lot of businesses, those foundations rely on 2 or 3 things. They rely on growth, some degree of maybe profitability, and the third is member experience, making sure your members, your patients, your employees, all your stakeholders are getting an experience that's unparalleled. But given the circumstances, collecting the data, collecting your team's thoughts and expertise is going to allow you to be thoughtful and strategic about pivoting. We all have to be comfortable with being nimble and pivoting. I can tell you these days, no matter how large the company is, and CVS Aetna, you know, a Fortune 5, has had to, like many companies, think about what a business plan looked like in 2019 and how to adapt and be helpful and serve its communities in a pandemic world. So being strategic and thoughtful about how you pivot is really key right now and going forward in this marathon. Next slide, please. Finally, regularly reassessing outcomes. As you thoughtfully think about changing your strategy right now, it's imperative that you have a set of measurements and outcomes that you look at to assess whether those decisions were correct. If you don't set those in advance, you're going to be flying blind, and you're going to be flying in some ways on the spur, which also has some dangers to it. It creates miscommunication. It creates confusion internally with your staff, externally with your stakeholders and your audience and your customers. So regularly reassessing the outcomes of your business through metrics, qualitative and quantitative, are so key to determining how you go back through this cycle. The last 4 or 5 slides I've shown you is a cycle. You continuously go through that process, and you have to go through it more frequently when you have a crisis like a pandemic than if you have a more stable atmosphere, ecosystem in which you live in. So again, I appreciate the time of being here with all of you. I want to leave some time for questions, and look forward to, at some point, meeting you all in person.
Thank you so much, Budhrani, for sharing your words of wisdom and lessons learned with us. We really appreciate it. We are about time to close, and believe that the time just flew by. So to get to their next sessions, we will close out this session. Attendees, please remember to log out and then go back and log in to the next session of your choice. On behalf of Linda, myself, and the GW School of Business, thank you to the speakers for taking the time to be with us this morning, and to the attendees, and we hope you all stay safe and healthy in these unprecedented times. Take care.